This is the Chapter 12 lecture, High Quality Healthcare. Both the Affordable Care Act and the American Recovery and Reinvestment Act ensured quality in a couple of different ways, linking payment for services to results and creating provisions that put providers on a path to high quality and affordable care. We need to understand the definition of quality, so read that here, and the 6 dimensions. Care should be safe, effective, patient-centered, timely, efficient, and equitable. How are we doing? Good in some areas, not so good in others. We have seen a reduction in cardiovascular disease, improvement in HIV management, reduction in the percentage of Americans who smoke, but we need improvement in care for chronic illnesses, the quality and safety of care, variations in clinical practice. How do we improve quality? That's the question that's very important to healthcare managers, because you need to measure what you are doing and with what result. You need to know what works and make sure you are doing. You need to use evidence. You need to look at the care process and make process improvements, prioritizing quality and safety. Take a minute to look over Figure 12.1, Improving Care Through System Redesign. I've been pushing you through homework and discussions to think about this system. Most issues with performance can be tracked back to problems in the system. So start by measuring what you are doing. That includes structure, facilities and professionals, the process, the services provided, and the outcomes, the end results. You need to acknowledge the scope of the measure. How much are you measuring? Is it the entire episode? And is the measure evidence-based, credible, and reliable? And then you need to use the data. That's very, very important. We need to be comfortable around data and use it to assess and to make changes. You need to know what works clinically based on scientific evidence. What we do should always be based upon the evidence. Valid measures reflect strong evidence and professional endorsement. And we need to improve organization and delivery at all organizational levels, micro, team, meso, and macro. When prioritizing quality and safety, remember the 5 C's: culture, capacity, capability, consistency, and candor. There they are in image form. And at the center of this is excellence, our primary goal. How do we incentivize quality care? There are a number of different ways. One of them includes public reporting, which we'll take a look at. Certainly payment, professionalism, consumerism, regulation, those all are described in your textbook. Professional is conduct, aims, or quality that characterizes the members of a given profession. So when we join a profession, part of that should be high quality provision or provision of high quality care. We should be committed to providing that care. Public reporting is very important because it makes the issues around quality transparent, and there is more and more of this that is being required. And payment, of course, is probably one of the most impactful ways of impacting quality. If you have fee-for-service, you're paying for more procedures, more to be done. And when we pay for performance, this really changes the game. It incentivizes the correct thing. Now, the textbook goes through, I'm not going to read all of this, a number of national and regional quality improvement initiatives. There's much more attention being focused on quality. And it also talks more about consumerism, how consumers of healthcare also drive quality initiatives as well. Regulation, of course, is extremely important. Credentials, accreditation, inspection. Uh, this can not only gather data and make that transparent, but also drive a push toward better quality. What are some major recent developments? Read through this. There are provisions in the Affordable Care Act, the National Strategy for Quality Improvement, and a whole list of non-governmental organizations that are doing really good work in research and laying down protocols for quality. Be familiar with lean. And of course, nothing is better than an activated patient. We need to empower patients and their families. So, finally, core competencies for health administrators involve solid grounding in quality measurement in the design and evaluation of intervention and programs. That's very important. That's why you are required to take statistics. That's why you're required to look at data.